Experts had warned there were likely more cases of the COVID-19 UK variant in Canada. We now know the first couple who tested positive had a connection to a UK traveler.
I think many had expected it, and noting that the UK had been describing this variant since September.
And today, more cases emerged, even beyond Ontario. The Public Health Agency of Canada says the new variant may be significantly more contagious, as early data suggest, but so far there's no evidence it causes more severe illness.
It's terrifying news to find out that there's a new strain here when we can't even control the original one.
Jessica Wong's grandmother is in an Ontario nursing home overrun by COVID-19. Currently, 128 residents have active cases and 41 people have died at Tender Care Living Centre. Wong's family had been working to get her out.
We got the call in the morning that she was in fact tested positive. So we were not able to take her out. We were just too late on that.
While the vaccine rollout continues, Wong is desperate for updates on her grandmother's health from overwhelmed staff.
If you try calling the floor with the nurse, that extension, it's impossible. We're relying on other family members to tell us information at this point, which is pretty sad.
Now, health authorities in long-term care homes are bracing for this new, more transmissible strain. But when it comes to vaccination, doctors expect the COVID-19 vaccines will still be effective.
We manage this with flu every year. The vaccine manufacturers have indicated that they'll simply adjust the production of their vaccine to take into account new strains.
Ontario health officials say large volumes of positive samples are now being screened to investigate how prevalent the variant is here.
We'll probably have a much better understanding of other variants, including this variant globally, as genomic tests scale up worldwide.
With holiday gatherings, the worry is it could be silently spreading. Talia Ricci, CBC News, Toronto.
Let's bring in Dr. Susie Hoda, an infectious disease specialist in Toronto. Hi, Dr. Hoda. Good to have you with us. Now that we know all reported cases here in Canada are people who acquired the new strain from travel to the UK or had contacts who did, does that change anything?
Well, to some degree, it's a little bit reassuring because it suggests that this variant has not been sort of introduced within the communities in Canada and spreading amongst people who haven't had a clear link to high-risk individuals or people who've been in areas where it's common. However, when it comes down to what we need to do, I don't think it really changes a whole lot. First of all, it reinforces the message that we need to have really good global surveillance so that when these kinds of mutations are detected elsewhere, it's communicated across the world and we're prepared for that. But second of all, it also reminds us how important it is to avoid travel unless it's absolutely essential, even now.
Speaking of places outside of Canada, as you mentioned, do you think this new strain of the virus, Doctor, has contributed to the speed of it spreading in countries where lockdowns don't appear to be as effective as they were in the first wave at containing the virus?
I'm not really sure that we can say that it explains why lockdowns have not necessarily worked so well in some areas, partly because that epidemiology doesn't quite match, in terms of where we know this variant is and what the experience has been. I think when it comes down to lockdowns, it's likely reflective of how stringently these are being imposed, whether or not they actually end up being successful.
Okay, thanks, Doctor. And Dr. Hoda will be back in a couple of minutes with us.